Doctors of Reddit. What was your worst, I don't think this is important, but patient? Had a male in his 50s walk into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. I told him I was going to write him up for an X-ray of the entire leg, just in case. He kept on saying he was fine. His knee hurt a bit, but logically that was from the fall. I agreed, but asked him to go to the X-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break, and he was walking around. In the end, I had to show him the break to get him to sit down on a wheelchair and into the hands of orthopedics. That man's pain tolerance still impresses me. If a farmer comes into the hospital willingly, something is really wrong. I intercepted a young woman who was just hit by a car. Her boyfriend was standing with her, freaking out. I did a basic physical exam and got a history and made her comfortable as we waited for the ambulance to arrive. Once the ambulance arrived, they asked for the same information. Except this time, the boyfriend mentioned he was actually the one who was hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact of his back. He was just freaking out and worried about her. He was in shock and hadn't begun to feel any pain yet. Had a patient come into the ER with some sort of spider or bug bite on her hand that had progressed to a red line running up her arm. She stated she put Benadryl cream on and it was very itchy. We continued talking and I asked if she had any allergies. Yes, Benadryl. I thought, good lord, what the hell? And I'm sure it was reflected on my face. We washed the Benadryl cream off her arm, and miraculously, it stopped itching. So this is the person that makes it necessary for medication commercials to say, do not take this medication if you're allergic to this medication. I guess sometimes this floor is made of floor really is a difficult conclusion to reach. Do you have any medical history, including things like heart attacks, strokes, high blood pressure? No, nothing ever. So why do you take this list of heart medications? Oh, I've had multiple cardiac arrests. I'm prescribed a blood pressure medication off-label for migraines. I had surgery a little while back and anesthesia stopped by to ask pre-op questions. I reviewed your med list. Do you have any heart or blood pressure problems? No, none. Really? My heart's fine. He frowned slightly and left. It occurred to me afterward that he must have thought I was an idiot for forgetting about my hypertension. This 20s guy came into the hospital. He had a lot of conditions where he wouldn't make it past 40, and he currently had some infection. We kept giving him antibiotics, which helped, but not as much as we would have liked. After about a week of being in the hospital, I walk in and I'm talking to him. He tells me that he got a medically necessary circumcision on his last admission to the hospital. I ask if it's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I'm just not sure how a 20s married man or his wife never thought to tell anyone about this for the past week. My sister works in a hospital sterilizing the medical instruments for surgery. She said one of the most common surgeries is foreskin removal due to infection. It's so important to teach your child how to clean it properly and proper hygiene in general. I was working in an area with lots of Mennonites. A mom called into the clinic because a wheel had broken and one of the spokes had penetrated her toddler's eye. The reason for the call was to ask if he needed to be seen by a doctor. She indicated they had removed the spoke and she knew he was going to lose the eye. So was there really a reason for him to be seen? The answer was yes. While pregnant with me, my mom was wrapping up an OB appointment. The gynecologist had already left the room. My mom was gathering herself to leave and mentioned to the nurse that her contacts were messing with her. She had spots in her vision. The nurse stopped and asked her to sit down. She brought a gynecologist back in, who had my mom stay and deliver me via emergency C-section. Without anyone knowing it, she had spontaneously developed preeclampsia and her blood pressure was skyrocketing. She was dangerously close to having a seizure, and that would have been it if she hadn't mentioned the spots in her vision and just left as the appointment was over, or if the nurse hadn't listened. I had to take out the remainder of this guy's teeth. He was in his 60s and told us verbally and on his health history that he didn't take any medications. So I took out his last 8 teeth, all easy extractions due to infections and periodontal disease. But I couldn't get him to stop bleeding. I asked him again if he was taking anything. I finally got the clot stabilized, but it took almost an hour and I had to consult our oral surgeon. When he saw the oral surgeon a few months later about placing implants, he told the oral surgeon he was on blood pressure medication and blood thinners. I refused to see him anymore after that. Or the ones who neglect to tell you that they have been getting bisphosphonate injections monthly for years. Or that they had head and neck radiation. I want them out, and the last guy I saw wouldn't do it because I told them about it. You gotta tell people the possible outcomes if they leave anything out. Are you taking any meds? Nope. Okay, because if you're on any number of common medications for someone your age, I will snap your jaw like a twig when I extract your tooth. Or you'll bleed out and die here in my chair. Oh, I'm on blood thinners. Yup, blood thinners. When I was in my final years of med school, the English division of a European university in a country where I speak the native language fluently, we were supposed to do patient interviews and physical examinations on our own and then circle back to our supervisor. I was translating back and forth between the patient from the infectious diseases department and a fellow classmate I was doing the interview with. The patient said, "So you guys are coming in on a Saturday to do patient work? Good for you for going the extra mile." It was a Friday, which I initially brushed off as a mistake. My classmate asked me to ask the patient if he could tell us the date. "Are you sure? He's here for an infection, not head trauma. He might think it's a bit degrading." I thought it wasn't important, but she insisted, so I translated the question. The patient replies, well, it's 2002, of course." It was 2018. After more questioning, we realized all of his replies were as if it were still 2002. The last trip I went on was to Africa in the 80s, so about 15 years ago. As it turns out, he had neurosyphilis that had gone unchecked for many, many years. Write in the comments which story you liked the most. And also don't forget to subscribe to the channel and like it. See you in the next video.